It's Dr. Abtahi here at AP Aesthetics, and I just want to review the process for doing wet to dry dressings. So as you can see here, this is our little setup of things that we're going to need to be able to do this dressing nice and appropriately with good, clean hygiene. First thing that I'm going to do is I'm going to go ahead and put a little bit of hand sanitizer on my hands, or wash your hands. And for most patients, the proper time to do this type of dressing is going to be right after you get out of the shower. Many patients who have open wounds will be able to shower appropriately by just allowing warm soapy water to run over the wound, let it wash in and out of that wound, and then pat it dry. Then after getting out of the shower, if you have someone who can help you, or if you're doing this yourself, you then clean your hands, put on some nice clean gloves, and then we're going to have our instruments and supplies already ready to go. We'll often ask patients to use one of two products to be able to do their wet to dry dressings. The first is going to be a product called Wash. Now this product has a very dilute amount of bleach. We never want patients using full strength bleach. That's a great way to cause a chemical burn. Instead, this product actually has some antimicrobial properties and can often help with cleaning up wounds that might be slightly contaminated. We'll do this product, but we will instruct patients when to use it and when to stop it. More often than not, we'll just use normal saline. So this is just some normal saline that can be picked up at any CVS. You can also purchase normal saline wound wash. That would also work. Sometimes they're sold in spray cans, which is very convenient for patients. You'll also need Curlax, which is a rolled gauze, or some 4x4s, depending on the size of your wound. And if it's a really small wound, maybe a ribbon gauze or even 2x2s. But we will give you instruction on exactly what it is that you should pick up. I also have a Q-tip. A long Q-tip is very helpful. In this particular case, we're going to be using a sterile ABD pad. This is an absorptive pad that will go on after we place that wet to dry dressing, and it keeps that wound protected, padded, and also prevents any blood or any of these fluids from soaking through the bandage. I have just a pair of pickups, a pair of scissors, and some tape. So you can see here that this patient that we're about to treat, what they have is they have a very deep wound on the back of their arm. So we're going to be packing this wound twice a day with wet to dry dressings. And what that's going to do, it's going to allow the wound to actually heal from the inside out. It's going to go like this, and over the next couple weeks it will start to eventually close. If you can imagine back in the days when we had no modern medicine and cavemen had to be able to heal a wound after being bitten by a giant tiger, they might have a hole in their leg or in a part of their body. The human body actually figured out a way to be able to close these wounds over time by secondary intention. So that's what we are taking advantage of by using a wet to dry dressing. So first things first, I've removed all the packing that was previously in this wound. I'm going to open up my rolled gauze, and then I'm going to kind of guesstimate how much of this do I think I'm going to need to be able to pack that wound. That looks like that's probably going to be enough. I'm going to save the rest of that rolled gauze, and I'm just going to trim this up right here. And for today's demonstration, I'm actually going to use the Wash product. So I'll oftentimes put that in my hand, then put just a couple squirts on this gauze to just lightly dampen it. You can see there's not much that's going on. We don't want to completely soak it. We want it to be just slightly damp with the product. And then when I squeeze, you can see all that fluid that I'm able to squeeze out. I'm trying to squeeze out almost as much as I possibly can. So that makes for a very slightly dampened gauze that can be used to pack into our wound. So that's where a long Q-tip is very beneficial. I'm going to try to pack this in all cavities of this wound. I'm going to take this little Q-tip, I'm going to try to find all the little areas that need to be packed, and just gently guide the rolled gauze into all the little nooks and crannies. And what I don't want to do is I don't want to shove it in there. I don't want it to be tightly packed. I want it to be loosely packed, kind of touching all of the areas and all the walls of the wound. So once I've done that, any excess amount here, I'll just trim. We'll tuck the rest in there. And this is where either an ABD pad can be placed directly over top, but in this particular instance, what we're gonna do is we're gonna use some of our 4x4 gauze, and we're just gonna place that directly over top of the wound and then tape it in place. Now, we will often use these modalities to be able to heal skin and soft tissue wounds, sometimes some deeper wounds that might involve some of the muscle. What we will see is that slowly over time, and it usually takes weeks, you'll see shrinkage of the wound in healing from the outside to the inside. We do want to do this twice a day. We want to make sure that in between our dressing changes, that the wound is cleaned either with a shower or using some saline spray. And one additional thing that we want to make sure of is that when we're changing these out, so let's say that I'm taking this out now, that we remove all portions of the gauze. So it's very important that we use a singular piece of gauze and not multiple pieces of gauze, because we can lose gauze inside of the wound cavity. By doing this, the whole thing will come out as a single unit. And that's incredibly important. The other thing we don't want to do is we don't want to re-wet the bandage or re-wet the gauze in an attempt to make it easier to pull out. Part of the benefit of doing a wet to dry dressing is that it does micro debridement. What that means is as this gauze starts to dry and adhere to the surrounding tissue, as you pull it out, it will actually pull away some of the dead tissue. It may even cause a little bit of bleeding and irritation, but that inflammation is incredibly important to reactivating the wound healing process. So we're taking advantage of that by allowing this to dry in place and not re-wetting it when we're doing a dressing change. Now, if you have any questions or you see anything that's concerning with your wound, please reach out and call us, because we need to talk about that immediately. We will always advise you on how best to achieve great results despite having a wound, should that occur in your transformation journey.